Hey there, so today we're going to talk about disc replacement versus disc fusion for the lumbar spine. So this is a model of what a lumbar spine looks like. It's made up of vertebrae, and then in between are the discs. So when we do a fusion, what we're doing is we're removing a disc at one or multiple levels, and we're putting a spacer in its place. A spacer is going to function by maintaining the space that the disc used to obtain, but also to take away the pain generator of the damaged disc. The disc fusion device looks like this, and this is called an ALIF cage. It's called an anterior lumbar interbody fusion cage, which means that it's placed from the front. And so you could see that there are screws here that once this goes into the space, they screw into the bone to keep it secure. Also, you can see that it is hollow, and this has bone graft in it, so that it allows the bone to grow from one bone to the other. What it looks like inside is this right here. You can see now it's placed in between the space where the disc used to occupy, and then the bone grows across it while the screws hold it in place. So that's a fusion. Now, a fusion will not allow motion. It'll stop the motion at that level. The other alternative is something called a disc replacement, which is this device. So instead of screws holding it in place and keeping the space open without moving, now it actually moves. And so this is very similar technology to what we use for hip and knee replacements. And what it is a metal plate and a metal plate with a plastic device in between that allows for articulation like a natural disc. This achieves the same purpose of removing the pain generator of the disc, removing any pressure off nerves, but you're achieving maintenance of motion, or also called motion preservation. And what that does is allows for the lumbar spine to continue to move in its natural planes by not fusing the spine. So this is an alternative. Patients can be qualified for one or the other, but it takes a consultation. So we have to determine which one is best for the patient, their pathology, and what type of injury they may have had to their lower back. So this is kind of the two alternatives to devices placed for the lumbar spine.